One of the things that's come up a few times in your sharing is this phenotype of TOFI, where somebody is skinny, but they still have the visceral fat accumulating. And you have a slide here I'm going to bring up.
Yes.
This will be a good visual for us to see what we're talking about there. So I'll have you explain, for somebody listening, there's 6 different images.
Yes.
And this is somebody with, on the high end of normal, a 24 BMI.
Yes.
But we're just addressing the point that you can be in that normal range.
Yes.
And you might have little or no visceral fat, or quite a bit. So we can't just go by that phenotype of what you look like on the outside.
Yes. So as you can see in this image, all the patients have the same BMI. And on the top left, you have a person who has very little subcutaneous soft tissue and very little visceral fat, which is what we expect, minimal to none, which is very rare to see. And when you move from the top left to the bottom right, you see that what increases much, and that's connected to what I was saying, that I believe the visceral fat starts first. What increases much is the amount of fat, which is the white inside of the abdominal cavity, which is the visceral fat. The subcutaneous fat doesn't increase much. So you can see that same BMI, all the 6 people in this slide, they believe that they are healthy because they have upper normal BMI and they don't seem fat because they don't have much subcutaneous fat. You cannot pinch a lot of fat. You don't have the love handles much there for you. But when you go from the normal metabolic healthy person, that person does not have much visceral fat. That person does not have low chronic inflammation released in their body 24/7, and increasing metabolic disorders such as dementia, diabetes type 2, fatty liver, and sarcopenia. When you go to the bottom right, you see that that person doesn't have much subcutaneous soft tissue still, so you don't have the love handles, but you only know that that person is metabolic unhealthy because you see lots of visceral fat producing all the chronic inflammation we have discussed so far, increasing the risk for chronic disorders that we have discussed so far as well. So again, we go back to the muscles, okay? So the muscles, when you are doing sprinting maximal effort exercise, you are increasing your testosterone, increasing your growth hormone, and decreasing your cortisol. When you are doing resistance, when you are doing the long cardiovascular, you are acting on substances called lactate phenylalanine. And this might be the cause of increasing stress, increasing cortisol, and sarcopenia. The differentiation between sprinting and long-term exercise in production of the lactate phenylalanine.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
All these problems we are having right now, all of these have been documented that are reversible just by burning your visceral fat. As a radiologist, I see visceral fat in